Good day. Welcome back. In this video, we will continue our discussion on Introduction to Clinical Pathophysiology. In the previous lesson, we introduced the foundations of clinical pathophysiology. We explained how normal body physiology function maintains stability, and how disease processes disrupt that balance, leading to patient deterioration. You also learned how to differentiate between normal and abnormal function. By the end of this video, you will learn how to match common clinical signs, such as pain, fever, and fatigue, to the underlying physiological changes occurring within the body. And beyond that, we will state the role of advanced practice nurses and midwives in using this understanding to guide clinical decisions. Let's begin with an important question. What do symptoms really mean? Clinical signs and symptoms are physiologic messages. They signal which systems are disrupted. Let's look at some examples. Fever reflects inflammatory and immune activation. Oedema indicates altered fluid balance and vascular permeability. Pain signals tissue injury or ischemia. And fatigue indicates reduced oxygen delivery, poor perfusion, or overall systemic stress. Mechanism-based thinking helps clinicians to avoid dismissing symptoms as mild, detect serious illness earlier, and decide when escalation of care is necessary. The key message is this: symptoms do not just happen. They are signs of disruption within the body's stability systems. Now, let's consider the role of advanced practice. Advanced practice nurses and midwives use pathophysiology to make decisions that are reasoned, defensible, and safe. This includes explaining symptoms logically using mechanisms, predicting how a disease may progress, recognizing early signs of compensation without being falsely reassured. It also involves anticipating complications, prioritizing interventions effectively, escalating care at the right time. Equally important is the ability to clearly communicate clinical interpretations to the team. In other words, advanced practice is not only doing tasks correctly, it is understanding why the patient is changing, and what must be done next to prevent avoidable harm. That is it for this lesson. In summary, this lesson showed that clinical signs such as pain, fever, fatigue, and oedema reflect underlying physiological changes in the body. By understanding these mechanisms, it helps clinicians detect deterioration earlier, make better decisions. It also supports timely escalation of care when needed. Thanks for watching. See you in the next section.